Are you sometimes struggling, not really seeing the details of your preparation and afterwards check it on your intraoral scan or impression and say, wow, was this me doing this? Then you're not alone. This is when you are not wearing loupes when working. You could also use a microscope, but basically loupes today are the standard of good, clear, precise vision. And that's why we are talking about loupes. I'm wearing loupes for many, many years, the standard loupes with 3.5 magnification. Today, we will try the new ExamVision Kepler Reflekt in Switzerland, distributed by Heinzelmann Optik from Bern. But wait, before we start into what loupes we selected, give me some information what the process is. What is the first appointment? What are you doing on the first appointment? And why it's also important to have experienced people like opticians to help you selecting the correct loupe, to set it up correctly, because there are 3 steps. Step number 1, you have to measure the distance between your eyes, because the loupes are mounted on the glasses. And if the distance of your eyes and the distance of the loupes is not the same, you don't see one image. You would have a double image. That's why this cheap go-to loupes, you can adjust the distance between the 2 loupes to adjust, but it's never that correct as when it's really measured professionally using this device we see here on the video. In addition, in your treatment room, so where you are working, you have to get a prefabricated version that almost fits your go-to loupes to sit in the position. The best is to get the patient in the chair in your usual working position to check the working distance. So basically for the Kepler Reflekt, it's about 50 centimeters of distance between your eye and the subject, the teeth, the mouth of the patient. They also check the position of your head. And so different measurements are taken into consideration to get your loupe as much personalized as possible. And then after all this, we need to wait 4 weeks to get these loupes manufactured individually in Denmark by ExamVision. Now, let's continue and let's see what loupes we selected. And maybe let me lift the surprise, the model we selected, and I hope you like it. So this is the 6-time magnification, and you have to look almost straight to see. Now I'm looking at my hand in 6.0 magnification. You have a good view over the loupes. So this is good when talking to your patients. You need this extra view. We also will have the light attached with this handy battery pack. So we have 8 hours of continuing light. So this attaches to your loupe. It's very handy. We have the orange filter, 3 levels. So basically you need to put this back that it's more comfortable. So you can move the lamp around, focus it, and then you have 3 levels of illumination. So this is really cool. I really like these loupes. They are very comfortable to wear. I will show you my journey, how to start using this loupe in my everyday workflow. Stay tuned for more videos. Thanks to ExamVision for supporting me, and also Heinzelmann Optik from Bern to follow me on this adventure using the Kepler Reflekt from ExamVision. If you have any questions, feel free to ask. I'm looking forward to your comments. See you soon. And may the light be with you.